computer now.
Okay, next up we have one final topic from a very renowned speaker, Dr. Xanya Sofra. She's actively been speaking in all international conferences for many years. I've got a chance to get to know her. So very interesting, very exciting, very visionary. So let's put our hands together and welcome Dr. Xanya on novel technologies for skin repair and hair.
1 second, we have some technical difficulties.
While we're sorting that out, just a reminder to everyone, a little announcement. Our closing ceremony will be at 3:30 right here in Volume 1. If you've not submitted your entry for the lucky draw, please do so. The lucky draw will take place during the closing ceremony. And after that, we ask for everyone to stay so that we can take a group photo with everybody around. Okay, there's CPD points for all these, for all the doctors. If you've not gotten it yet, please contact the secretariat and scan the code so that we can scan the QR code to get the CPD points with you. And if you've got any pictures taken with any of your friends or anyone new that you've met today or these past few days, please do share it on social media and hashtag AFMS24 and hashtag SAAARMM. We'd like to get in contact with all of you, and hopefully, when we finish this conference, then we can continue to contact each other. We can continue to get updates from our society for all the future events for you as well. Right. So let's put our hands together and give a warm welcome for Dr. Xanya.
Okay, so
thank you very much for inviting me, Dr. Tan. I'm honored to be here, and we're going to be talking about novel modalities for skin and skin repair and hair growth. I have no conflict of interest, and this presentation is based on a review of 390 articles. I prefer to collect a lot of data so I can offer you a sort of a summary of what I have learned. This is some of my books that have been translated in 12 different languages, and I have written about 56 articles that are related also to this presentation. Now, what is skin aging and disease? It boils down to one thing: inflammation. And what you see from a lot of different articles and a lot of research is that when you experimentally deplete one or more of the inflammatory cell lineages, then what you see that there is no any scars or keloid scars, and the wound healing is enhanced. So, and what is cancer? Cancer is a wound that never heals, basically. So inflammation is present in adults, but not in embryonic wounds, which means that the people, basically embryos, do not have the inflammation, and that's why they heal much faster. Now, how to evaluate different published studies? That's a very important thing that I would like to deliver to you today. And the number one thing that you need to look at, if the name of the device or the name of anything is listed on the study, then the study is being paid for. The second thing you need to look at is basically what is the data. Because a lot of studies, especially laser studies that I have come across and radiofrequency studies, what they do is they say our results is 0% 0.0001, but when you look at the data, you see 99%, 0001 is 99% plus, 99.9, but in fact, only 34% got the actual benefit, which means it's over there. That's 34%, that's 99%. So they're basically reporting results that they have not reflected in their data. And the data actually reflects below chance. So you need to be aware of statistical significance. It has to be at least 95%. So when they say 80% of the people got it, well, that's not significant. Or 70%, that's not actually significant. So you need to look for significance. You also need to look for long-term results. Because, okay, it works now, it works this moment, it works for next week or this particular year. But what happens 10 years later? That is also very important to understand. You also need to look at adverse reactions, because a lot of times you have scars or infections that are underreported. Or they say, well, 4 people out of 22 had adverse reactions. What exactly were the adverse reactions? You need to look at that and understand it. Now, with repeated, for example, trauma energy procedures, what you get is you get what we call the granzyme B, that speeds up aging. And you also need to look with astute eyes what exactly are the results of your treatment. So basically, this is the marketing and this is the actual results. You need to look at actually the results of the treatment. Now, for example, cryolysis, as you can see before, and after 2 years, it's exactly the same thing. Again, with astute eyes, look at the results. Do not do it like the emperor's new clothes, where we say, oh, these clothes are wonderful, but the emperor has no clothes at all. And then you need to look for novel technologies, different technologies. Open up your horizons and invite new technologies in and understand what they have been underreported because they don't do very much marketing. Marketing is brainwashing. Basically, not be brainwashed. Observe for yourselves. And there are some novel technologies with ionic currents, for example. This is Wandel and some other researchers that have done these technologies for wound healing. And they also have ultra-low energies that they have used, again, for different healing. This is just international research. And the rationale is that with basically with biomechanisms that at the molecular level, they can go back in time. They have time reversal. And that's the only time that you can get time reversal. For example, a free radical, all it needs is an electron and it becomes a stable molecule. And then there is all these other technologies that have to do with skin repair via resonance. And what is resonance is basically a process where it amplifies the signal through resonance. So the signals get amplified. And resonance can basically restore signaling pathways through this process of resonance. And it can do it at energies extremely low, that are below thermal noise, that the resonance signals can enter the cells. And that is a mathematical formula that has been proved since 2008 by a book called Electron-Gated Ion Channels by Branston. And it basically mathematically proved at those energies that the ion channels, the doors and windows of the cells open up. And this is how, for example, one protein can affect another protein through resonance. And this is the microscope that you can observe these resonance signals and how they affect the cells. And this is how the cells can communicate without actually connecting to each other through this resonant process. And this is a lot of research that has been called the psychic cells. And they basically, the way this technology does, they combine different frequencies, they put them together, and then it's like this process, this is like thousands of these equations to create one signal. Now, why do lasers and RF do not work on keloids, or they basically shrink the keloid and then it comes back. About 34% of the keloids come back. Why? Because these regulated cellular signals and also this regulated timing of every cell has its own timing. And this is basically before and after of a keloid that we did. And this is basically the Nobel Prize of 2017 when they looked at the timing of the cell, and they found out that each cell has its own circadian rhythms. And by kind of looking at these circadian rhythms, when these rhythms are disturbed, you have, for example, psoriasis. It has been associated with the circadian rhythms of the cell. Now, this is an article that I did with Dr. Lambert from Aruba. These are head patients. That's before and after of wound healing. And this is a diabetic wound. This lady was supposed to have her leg amputated, and we were able to save her leg, basically. And after 1 year, the wound did not come back, and I think that's the most important thing. And that just anti-aging results. Some more anti-aging results after 20 minutes. This is a Bell's palsy after 3 treatments. That's before and after 3 treatments. It was completely. Now, this is another Nobel Prize, and basically it has to do with the folding of the proteins, which is what resonance does. It basically folds the proteins. And what is a protein? When you fry an egg or when you boil an egg, basically what happens is that the proteins of the egg get unfolded. So can you refold the proteins? Can you theoretically unfry or unboil an egg? And the answer is yes, you can do it through this resonance process that has been, it's a new science and now it's been more closely investigated. And there are, basically you can refold the proteins through resonance. And there is a lot of science today that can do it through plasma resonance and other techniques. The acrylic, there are many techniques that can sort of try to fold proteins. And there is also a measurement test, the second virial coefficient, that you can look at aggregation of the proteins, which means that the proteins are unfolded, or lack of when the aggregation is decreased, and that's when you have a protein fold that is successful. And this is basically how you can measure the results of your test. This is some anti-aging results before and after. This was in 2017, 2022 it looks better than before, and again 2019 to 2023 on pigmentation that was permanent. Now let's go to hair loss. What causes hair loss other than basically pulling your own hair, somebody else pulling it, as the cartoon indicates? Primarily there's 2 reasons for hair loss. One is metabolism, and the second one is nutrition, and the third one is inflammation. Basically, inflammation will create this hair loss. It can be just inflammation in the body, general inflammation. So there's a lot of articles with alopecia and inflammation, and sometimes inflammation can be for psychological reasons. We have had alopecia because of stress, of continuous, basically psychological stress that will cause the inflammation. So body and mind are working together. You cannot say, oh, this is psychology, this is physiology. Actually, they're one and the same thing. They're intertwined. So you have a lot of other research with the inflammation because of some kind of a inflammatory situation, the bowel or some other inflammatory situation that causes the hair loss, the patient got hair loss. And you have a lot of laser studies that they have done, and a lot of them, what they do is they combine, like this particular study combined minoxidil and the fractional laser, and they found, actually, if you look at the results, there's no difference between, what they did is they had minoxidil and laser, but they did not have just laser to see if the laser itself can do anything, or is it the minoxidil that does it? Because when you look at the results, they were better with the laser, but maybe because of the kind of the heat created some kind of an additional result. And the other thing is that you need to look for conflicts of interest. If these people have been paid by a certain company to write the article, and also if it is an animal model or a human model. So this particular study, for example, is an animal model. This is another treatment before and after. I cannot particularly see any results. I see it's like the same picture to me, but I don't know, maybe it's my eyes. Now, the problem with radio frequency is that there's a lot of articles that have not been paid that show that radio frequency actually increases inflammation. And radio frequency, we know for sure that it enlarges proteins. In other words, it unfolds protein. Remember we're talking how we can fold proteins through resonance to create hair repair and also the skin repair. Well, radio frequency actually unfolds them. And that's something, and this is what an unfolded protein looks like. And this is what a normal protein looks like. And you have basically natural proteins. Look, when they lose their 3D structure, they cannot function. And they result in several diseases, very serious diseases like cancer or Alzheimer's. Now, there is a utility for lasers and RF. There is a very important utility for that, and that's for hair removal. Actually, RF can actually ablate cancers. So they are very useful in certain settings, especially medical settings. And also, about 15 out of 19 studies that I looked at in lasers for the utility of long-term, they were long-term hair removal. And that did work very, very well. So there is a place for that. But for hair growth, I would prefer something that is like a resonance technique. Why? Because, and this is what resonance I showed you before with a movie. So I would prefer the resonance situation. Why? Because that would heal. It's a healing. Basically, the resonance will increase the healing capacity. And we did a study with this London University technology that was originally invented there for cellular regeneration. And in one treatment, we could see, the hair sticking out. And second treatment, you can see a significant improvement in the hair. This is a doctor in Hong Kong, Dr. Bob, actually. And this is after the fourth treatment, and after the fifth treatment, you can see again a significant improvement in the hair. This is another study with an earlier technology that's after 4 treatments, you can see hair growth, and that's again after 4 treatments and in 3 months' time. So it takes time. It's not automatic. It does take time. And that's that's within 1 month, you can see it's not as significant. But with time, you see more results. And what I'd like to talk to you about now is something that that you should consider. I think that after the pandemic, there has been a shift from beauty to health. And a lot of doctors are complaining of losing their customers. Why? Because they persist on beauty, they persist on what's today. And a lot of people, they're still asking for treatments for today, but at the back of their minds is that they want to find out what's going to happen tomorrow. They want to know about health. So if you start focusing on health and immunity, and remember, a young person that is ill looks much worse than an old person that is healthy. You cannot look beautiful if you are unhealthy. So you need to start looking at health. You need to start looking at how you're going to improve health by focusing on the immune system. This is the center. This is the gestalt. You fix that, you fix everything. So health and immunity is the secret to age delay and the secret to anti-aging. Real anti-aging. Not just, making something and looking younger, just superficially younger, but the real anti-aging. So we need to focus on methods and technologies that enhance the immune system. Like this doctor at the end over there is doing. So we need to turn around and go towards health. Everybody's going towards beauty. If you go towards health, you're going to be a pioneer. You can either be the one who's blindfolded and follows everybody, or you can be a pioneer. And it's difficult, but it's very gratifying in the end. And that's what's worth it. So health is beauty, but beauty is not health. And that's the message I would like to leave you with today. And with this, I would like to end my presentation. Thank you. Any questions?
Thank you, Dr. Xanya. Is there any questions from the floor?
Dr. Sofina, do you have any questions for me?
I do agree with you, Dr. Xanya, about
I can't hear you. Huh?
you cannot be beautiful without health.
Come to the mic.
Come to the microphone so we can hear you, because it's a big room and your voice.
I'm saying that I do agree with you that health is beauty, and you really cannot be beautiful without health. And I have seen that sort of similar desire from patients as well after the pandemic, where there's a heightened desire to be healthier and better. But I also feel that because I'm more into aesthetics, as you all know, so I mentioned this to you earlier.
Yes.
That some people do need to have that beauty on the outside.
That instant gratification.
To motivate them to feel better on the inside, or to do things that's healthier for themselves, to get rid of those things, diseases in themselves, or to adopt a better lifestyle. So yeah.
But Dr. Sofina, you are one of the pioneers. I know you have to kind of compromise and kind of deal with all the people that, and what they want in your clinic. But you are one of the pioneers, and I respect you for that.
Thank you. I think it's really also because a lot of my patients are also growing older with me, and so they need to be healthy. And I appreciate that your technology, the waveform technology, has helped in terms of helping them to adopt this being healthier.
I'm an advocate of health. And I think health will bring beauty. That's my theory. Any other questions? Can you come to the microphone? I cannot hear you. Sorry.
Thank you for your presentation. Now, you were showing a slide on hair loss, and you were saying resonance help improve hair loss. Is that without minoxidil or just resonance per se?
No, nothing to do with, the minoxidil had to do with another study, with a radio frequency study. What they did is they used, one group had only minoxidil, and another group had the radio frequency and, low laser, low fractional laser and minoxidil. And what they found is that the one with the laser did better, but if you look at the data, it's not really significant. So basically, it's about the same. So but the minoxidil was doing more of the work.
Well, there was another paper that you presented on resonance.
The resonance has nothing to do with minoxidil. The resonance has to do with basically energies below thermal noise. Very, very, very low energies that they're imperceptible, that you don't feel. And you don't feel them because it's mathematically proven that those energies, the ion channels of the cells, the doors and the windows of the cells, if you like, open up. And at those times you can put signals signals that are blueprint signals of the biosignals, the signals that you have inside. So in order to figure that out, it takes us like years, like 10, 20 years, to figure out what are these signals. It's like a lot of research from many, many different people to understand how we can combine these signals. And once the signal is similar to what's inside, they can basically enhance the signal that is inside that has subsided, that has basically broken. So when it repairs, when it reinstates signaling pathways, then the body will take over, the immune system will take over, and then heal, and then create the healing. The inflammation is going to go down. Inflammation is an excessive response to something that is wrong. And basically the blood is there, it gets stuck. Okay, it's like water when it rains, like it gets like all the bacteria and everything. And what it does, it basically unblocks the system. So that's why I appreciated the earlier speaking about also, he's talking about unblocking the system. This is what this technology does as well, unblocks the system. It's like you have a blockage in Kuala Lumpur at rush hour. Can you imagine like a block in the street, what's going to happen? Nothing is going to move, you're going to be there for 7 hours. So unblock the system, everything starts working. Then the body will take over and fix it. The body has the repair mechanisms. And it's much better. The body, our brain and our body, our immune system, knows much better than any of us.
And I come with the next question. With the massaging the scalp help too in rejuvenating or in hair loss? Because the yesteryears they used to use oil and massage the scalp.
I would assume so, yes, because basically by massaging the scalp, you are reinforcing the blood flow, and the blood flow is going to kind of stimulate the immunity, and all that is going to, one thing is going to bring the other. So yes, I assume that would definitely help. Good suggestion. Anything else?
Is there any other questions? Okay, if there's no other questions.
Thank you very much, Umar. Thank you.
Okay, the closing ceremony is going to be starting at 3:30, so we've got about 5 minutes or so. Maybe we can all have a short break, grab a cup